The WHO recommends that there be one surgeon for every 20,000 people, and what we find in Africa is that that number is actually closer to 1 in 250,000, and in the worst places, 1 in about 2.5 million people. That would be like having one surgeon in Cleveland. When I was allowed for those opportunities to go and start to help train African medical graduates in surgery, it became something that I wanted to be part of my surgical career. My name is Kevin El-Hayek. I work at Metro Health Medical Center in Cleveland, Ohio. I work in the division of surgical oncology and general surgery. And my main focus is in upper GI surgery, cancer operations, and endoscopic surgery. I met Afa Monyema when we were both undergraduates at Harvard University, and we kept in sporadic touch up until 2005 when I learned that he had established GEANCO with his family. GEANCO was initially working predominantly with orthopedic surgery and offering joint replacements for the poor and vulnerable population in Nigeria, whereas I was starting to get involved with another organization called PACS, or the Pan-African Academy of Christian Surgeons. And so when I reached back out to AFAM several years later, I said if he ever wanted to have a mission in minimally invasive surgery, I would be happy to lead that. Nigeria is the largest country in Africa, and it still has a significant need and a lot of poor access to surgical care. There's not a lot of minimally invasive surgery that goes on there now. When we were there, we performed 11 operations during our one-week trip, and the average length of stay was 1.5 days, so patients were home really quickly. And we followed up with them afterwards and learned that about 1 to 2 weeks later, these patients were back to normal activity. That is just something that really changes the dynamic in their community. They're able to go back to their homes, back to work. And specifically in communities where hard labor is pretty typical, that's such an important thing that we've been able to offer them. We partner with local surgeons and local trainees so that it's not simply flying in, doing a bunch of minimally invasive operations, and then the work doesn't continue when we leave. And that's really, I think, an important concept of those organizations, is that we go, we train, and we provide supplies and equipment that will last so that they continue the work when we're gone. And one of the things we're really proud of is being able to establish some WhatsApp groups for the surgical team in Nigeria, and so it's pretty rare that a week goes by that we don't hear of another case that we will provide input for them to provide that care even after we're gone. So it's a really important thing about GEANCO's work, where we're able to continue these relationships. Organizations like GEANCO, they're shifting the needle toward patients getting care that they need, and specifically focusing on the vulnerable and the poor. Every single patient who has a disease, I believe, should have access to the care that they need to treat that disease. When I go to meetings and we learn about some of the intricate things that we now offer patients, it's always in the backdrop of knowing that the vast majority of the planet doesn't have that access. And that's really hard for me. Because to think that we're a globe of 7.8 billion people and most people can't have appropriate surgery is heartbreaking. Organizations like GEANCO, that's their main goal. Their work is changing the lives of poor and vulnerable in Africa. It's really changing the lives of those people. And I want to be a part of that. I think that's an important part of my legacy, is not just treating people who have access, but to find those who don't have access and to go to them and help them get that access.